Hello, my name is Brenda Beard, and in this presentation I will be going over a community analysis of Dunedin. I will present a brief historical overview, a community analysis of its structure, population, health-related resources, environment, government, and public policy. This presentation will identify problems within the community and prioritize them. Dunedin is one of the first towns in the state of Florida. In the early 1880s, Scottish families became the original settlers of the community, which was later named Dunedin. Early settlers built docks to accommodate sailboats and grew citrus and cotton farms where downtown Dunedin now lies. The Dunedin area soon became one of Florida's chief trading centers. Dunedin officially integrated a town in 1899, which then grew into a city 25 years later. Today, Dunedin is known for its beautiful charm, boating, natural wooded areas, waterfront, downtown shops, Blue Jay training stadium, beachfront state parks, and historical roots. Dunedin still honors its heritage roots each year with Scottish athletic competitions, Highland dancing, and traditional bagpipe music at the Highland Annual Games. In honor of Dunedin's citrus growing heritage, it hosts a Orange Festival every July. The housing real estate in Dunedin consists of homes, condos, and apartments for renting or buying. Dunedin has a limited number of housing resources such as homeless shelters, halfway housing, supportive housing, and day shelters. In Dunedin, U Park and Whispering Hills are two affordable housing options in which individuals who qualify only have to contribute 30% of their income for permanent housing. The three U Park housing group homes are available for individuals with disabilities, while Whispering Hills is available for families. Dunedin Parks and Recs set the Live Well goal to inspire a healthy lifestyle throughout the community, physically, mentally, and socially. The Dunedin Community Center and various recreation centers offer fitness classes, programs, fitness centers, exercise rooms, and outdoor fit zones for a reasonable rate. There are many schools located in the Dunedin area. There are 4 elementary schools, which include Dunedin, Garrison Jones, San Jose, and Citrus Fundamental. There is 1 public middle school and 1 public high school, Dunedin Highland Middle and Dunedin High. Other schools in the Dunedin area include Dunedin Academy, Discover Academy of Science, Academy Da Vinci Charter School, Our Lady of Lourdes Catholic School, and Dunedin Montessori Academy. There is 1 public library located in Dunedin. Dunedin's public library offers a variety of programs, classes, tutoring, and workshops for all ages. Computers, books, and Wi-Fi are also available to the public. Museums and historical landmarks in the Dunedin area include Dunedin's History Museum, which collects and preserves historical artifacts and documents of Dunedin. Located in Hammock Park, Andrews Memorial Chapel is a historical landmark in the community, which was built in 1888. Fenway Hotel was built in 1927 and is home to the county's first radio station. It transformed from hotel to school and is now a beautiful hotel once again. Dunedin has a total population of 36,545 people. Of this population, 30.6% is over the age of 65. This percentage is greater than that of the county, state, and country. According to Healthy People 2020, adults over the age of 65 have a higher risk of chronic diseases such as heart disease, cancer, lung disease, stroke, diabetes, and Alzheimer's. These chronic diseases in adults contribute to the leading causes of death among this population. This greatly increases the need for healthcare services within the Dunedin community. 84.7% of the Dunedin population is Caucasian. This far exceeds that of the state and county. This is problematic as it could lead to inequality and healthcare disparities among vulnerable ethnic groups within the community. The highest prevalence of communicable diseases in the community, county, and state includes STDs such as chlamydia, gonorrhea, HIV, and syphilis. These communicable diseases are one of the leading causes of morbidity and death in Florida, especially among at-risk populations. Leading causes of death among the population include cancer, heart disease, respiratory disease, stroke, and diabetes. Located in downtown Dunedin, Dunedin East Hospital is the only hospital located within the community. The hospital is in a central location, is accessible 24 hours a day to the public, and accepts most insurances. There is a vast number of facilities and health-related resources available within the community that are easy to access. These resources accept most insurances and have affordable costs which vary. There are 18 assisted living facilities and retirement homes located within the Dunedin area that provide long-term skilled care for our aging population. Facilities are open to the residents and operate 24 hours a day. Bay Area Pregnancy Center and Kimberly Home Pregnancy Resource Center offer free services to individuals who are pregnant or those who have an infant. These centers are easy to access and provide a 24-hour crisis line. Dunedin Community Health Center serves residents of Dunedin and within Pinellas County by providing affordable, quality primary health care services to all. Services provided include family practice, pediatrics, behavioral health, and women's health. The facility uses a sliding fee scale and most insurances are accepted. The following Healthy People 2020 objectives were chosen for the community of Dunedin. Objective SA 14 and 15 aims to reduce the portion of persons engaging in binge drinking or excessive drinking of alcoholic beverages. Within the community of Dunedin and countywide, binge drinking and substance abuse has been on a rise among adults and youth. There continues to be more breweries and bars opening in downtown Dunedin, and alcohol is easily accessible at most grocery stores and restaurants in the community. Objective C1 aims to reduce the risk of overall cancer-related deaths. Recently, there has been a noticeable increase in death rates for cancers such as melanoma, breast cancer, cervical cancer, and lung cancer. This may reflect a lack of access to treatment, cancer screenings, and early preventative care. The objective of IVP 11 is to reduce unintentional injury. The goal for unintentional injury, according to Healthy People 2020, is to prevent unintentional injuries and reduce its consequences. Objective IVP 25 specifically targets reducing drowning deaths. Drownings are of a particular concern in Dunedin, Pinellas, and Florida, where numerous water sources provide opportunity for death by drowning. Honeymoon Island and Caldesi only have lifeguards on duty a few months out of the year, and lifeguards are not easily accessible for help. The City of Dunedin has taken extra measures to protect the public from environmental safety hazards. This has been done by ensuring a safe, reliable water supply, ensuring a safe air quality index through the management of air pollution, managing solid, hazardous, and recyclable waste and sewage disposal, as well as preventing and managing vectors and mosquitoes through treatment and spraying of areas. The City of Dunedin provides an adequate number of community resources within the environment. These resources include 17 parks, 5 recreation centers, a fitness center, and a community garden. These address the social and health-related needs within the community. The City of Dunedin fosters safety within the community through its local law enforcement and fire department. The Pinellas County Sheriff's North Office District is located in downtown Dunedin, serving the community, local schools, and county preserves. The Dunedin Fire Department operates from 3 fire stations, which include 60, 61, and 62, which respond within an average time of 7 minutes and 30 seconds. The City of Dunedin is governed by a mayor, vice mayor, and 3 commissioners who are elected by registered voters under a staggered system. The City of Dunedin operates under a nonpartisan commission-manager form of government. The mayor, vice mayor, and commissioners serve on regional and county boards and committees as a voice that adds the viewpoint of the community. There are 39 volunteer boards or committees that help advise the City of Dunedin. All City of Dunedin commissioners can be contacted via email. Commission meetings are held twice monthly in the City Hall to discuss issues related to the City of Dunedin. These meetings are open to the public or can be viewed on the Pinellas County Connection TV channel. Official city records, maps, and financial statements are available for the public to review on the City of Dunedin webpage. The following problems have been identified in the community. Problem 1. There is a need for homeless shelters within the community. Dunedin has a limited number of housing resources and does not have homeless shelters accessible to the homeless population within city limits. Therefore, the city is unable to meet the basic needs of the vulnerable population, which can contribute to poor physical and mental health and can lead to illnesses within the homeless population. Problem 2. Cancer. Recently, there has been a noticeable increase in death rates for cancers such as melanoma, breast cancer, cervical cancer, and lung cancer. Access to treatment, cancer screenings, and early preventative care through services and programs have been crucial in reducing the incidence and impact of cancer in the United States. Problem 3. Excessive alcohol consumption or binge drinking. Within the community of Dunedin, binge drinking and substance abuse has been on a rise among adults and youth, and alcohol has become more accessible in the community. Alcohol is a large concern because it leads to many risky behaviors and increases the risk of chronic and communicable diseases and leads to early death. Problem 4. STDs. Due to the high prevalence of STDs such as chlamydia, gonorrhea, HIV, and syphilis, these communicable diseases are one of the leading causes of morbidity and death among at-risk populations within the community. Problem 5. Poor nutrition. Due to the amount of places to eat out or get fast food, poor nutrition is an issue that has been observed within the community. Poor nutrition can lead to poor overall health and diseases which include being overweight or obese, tooth decay, high blood pressure, high cholesterol, cardiovascular disease, stroke, diabetes, osteoporosis, and some cancers. Some of these are the leading causes of death within the community. Problem 6. Unintentional injury. Due to the lack of accessibility to lifeguards and lack of bicycle lanes, unintentional injuries such as drownings and pedestrian accidents are of a particular concern in the Dunedin area. Rip currents have accounted for an overall average of 19 deaths in Florida each year since 1989. Florida recorded an annual average of 5.7 cyclist deaths per 1 million residents, which is far more than any other state. And Pinellas County has the highest average of cyclist deaths in the U.S. The prioritization of community needs was based on the Maslow hierarchy of needs and the prevalence of issues within the community.